All right, I think we are legit now. We are in the right channels. We are on the right video. So this is an informal live Q&A. Sorry about that for all the people that were waiting and waiting and waiting. So what happened to Ed? What happened? He disappeared. Black helicopters or something like that. But anyway, all right. So we are here, and we're gonna. I'm gonna answer as many questions as I possibly can in the next hour. So if you've got any questions, go ahead and ask them in the live Q&A, and we'll get to as many as we possibly can. A lot of questions. I did a video yesterday about the big beautiful bill, how that affects Social Security, retirements, Medicare, Medicaid, and a lot of people had questions about that. So we want to. I ran out of time yesterday, and then I messed up my live today. So we're back again, and let's see what we can do to help you all out. Okay. Let's see. Ralph says, you help lots of people get what they are entitled to, but does it make sense to apply for extra stuff if they just deduct it from your regular benefits? Yeah, it really depends what it is. So, yeah, that's kind of a catch-22 situation sometimes. That happens quite often when we're talking about like a COLA increase. There's people out there that receive, Medicaid and, food stamps or whatever the case may be. And you would think that they would be very, very happy when you got a really big COLA increase. Like a few years ago, they got 8 points, we got an 8.7% COLA increase, and you're like, oh, that's awesome, awesome, awesome. But the problem was that put some people over, the limit for, food stamps or Medicaid or SSI or whatever the case may be was $1,200. And now they got $1,203. And so they got an extra $3 and they're like, woohoo, I got an extra $3. But now they lost hundreds of dollars of help in, SSI or Medicaid or food stamps or something like that. There was actually a movement, a bill that was going through Congress, but yeah, we know what a bill is, right? It's just a bill until it becomes law. So this is another thing. Social media people out there, they find some obscure bill that sounds like super awesome that's never going anywhere, and they make a video about it, and everybody gets excited, and so if it looks like it might pass, then people should get excited and call their politicians. But there was a bill that said, okay, if you get just a little bit more, you shouldn't have critical benefits completely cut off 100%. They should be maybe scaled back a little bit. But yeah, that one unfortunately went nowhere. That was like a Led Zeppelin, I guess, right? Not the good band type. Let's see. I want to know why my Social Security is so little, $400. All I get if your Social Security is only $400, so Social Security determines your benefit amount by how much you actually paid into Social Security all of those decades. So your high 35 years of earnings. So that's how it works. So they look at your high 35 years of earnings, doesn't need to be consecutive or the last 35. They look at your entire work history, and they index it for a wage index as well. So you're like, wow, I made, $10,000 when I was 20 years old, 40 years ago. That's definitely not more than I made. Yeah. When you're 20 years old and made $10,000, that might be worth $100,000 today. So they index it for a wage index, like an inflation. And then they take your average index monthly earnings. When they index it, they take your average earnings, and that's how they come up with how much you're going to get from Social Security. So it's based on your work record. But if all you're receiving is $400, you want to make sure you're getting all your other benefits. Were you ever married to someone that worked and paid more? Are you eligible for spouse benefits or divorced spouse benefits or independently entitled divorced spouse benefits or disability benefits or surviving spouse benefits? You want to make sure you've checked out all of those options to get everything you're possibly eligible for. And if you're not eligible for anything else and you only get $400, then remember there's another program. It's called SSI, Supplemental Security Income. People mess this up and they think it means Social Security income. No, SSI is a completely different program. It is administered by the Social Security Administration, but it's a welfare-based, needs-based program. So you have to have low income and low resources. So if you're making only $400, then you need to reach out to Social Security and see if you're eligible for SSI, Supplemental Security Income. And the max you can receive on SSI is $967 this year. So if you're currently receiving $400 and you're, just that's your retirement check, that's all you get, then, and you've got no other income or anything, then what will happen is you'll continue to get that $400, plus you'll get another $567, up to another $567 from SSI, the welfare-based benefit. And then if you're eligible for SSI, you're what's called categorically eligible for Medicaid from the state. Well, you're theoretically eligible, but because of the big, beautiful bill, that seems to be changing. You used to be categorically eligible. That means if you're on SSI, they automatically give you Medicaid. Now it's not going to be automatic. You're going to have to fight for it, unfortunately. So, let's see. My spouse and 2 minor children were just approved for SSDI. If my spouse's benefits are reduced at a later date to earnings income, what happens to the benefits for the kids? Are they reduced? Normally not. So basically, if the children are entitled to 50%, but if benefits stop because of work, then that's a whole different issue. But remember, check out my website again. I have got disability. If you're on disability, work requirements are kind of difficult to, kind of navigate. So you go onto my website, click on the disability part, and working while receiving benefits. So I've got a kind of a PDF guide, Dr. Ed's Insider Guide to Work Incentives. It gives you kind of, I think it gives you a pretty good introduction and details on working. And I also got a little calculator, and it gives you all the different things. So basically, the first thing is a trial work period. So, would you say your wife, was it? I think it was. If your wife wants to work and receive an SSDI, they can. Anybody can. Actually, Congress and everybody says if you're receiving disability benefits and you want to work, we are going to allow you to work because we want you to go to work because it's good for you, it's good for the trust fund, it's good for the taxpayers, it's good for everybody if you're able to go back to work. So they give you all these incentives to go back to work. The most important one is the trial work period. So the trial work period is basically 9 months, doesn't have to be consecutive. But for 9 months, you can make $1 billion a month. And Social Security doesn't hold it against you. So the trigger is $1,160. So if you make under $1,160, anybody on disability can work forever on SSDI benefits, on SSDI, not SSI, but SSDI. But as soon as you go over that $1,160 for this year, then that's a trigger month that starts your trial work period. So that becomes 1 month of your 9 months. And then you can work 8 more months and make as much as you want. It doesn't affect you. And then once you switch from there, then you go into what's called the extended period of eligibility. And so then it's different. Then it's the substantial gainful activity, which is this year is $1,620. So it's all complicated. But if they're able to work, then, everybody wants that to happen. I'm sure she does. People on disability would like to go back to work if they're able to, but sometimes you just can't do it. But it doesn't hurt to, try, and Social Security doesn't hold it against you. That's the way Congress wrote it. So I think it's a good thing. Brenda, my husband passed in June, but they took his June Social Security back pay. Why? Wouldn't that have been his May? No. So what it is, a person has to be alive the entire month. So if someone passes on June 15th, then the check they get in June, that's for May. But if they pass away on June 15th or June 29th, then they're not alive the entire month. So the July check would be withheld. So And what happens is if the person passes away in the United States and the funeral home or the coroner's office, they notify the state, and the state notifies the Social Security Administration, which notifies the Department of Treasury and immediately stops payment. If the payment is already sent out, then the Department of Treasury, anybody that lost someone knows this, the Department of Treasury will suck that money out. So you just, if you're not entitled to that last check, then the Department of Treasury will just go ahead and pull it out later. So, and that's one of the things politicians have used recently about, trying to attack Social Security by saying Social Security is so incompetent, they're paying millions of people that are deceased. Well, Elon Musk, that whole thing, that was incorrect. The 120-year-old people, yeah, that was all BS. He never found one dime there. But does Social Security pay deceased people? Yes, they pay deceased people every day. But they get the money back. So if someone passes away yesterday and they get their check today, yeah, it just doesn't happen that fast. The states have to do the whole process. It's pretty quick, but not that quick. And then what happens? You keep the money in there. Department of Treasury comes in there next week and pulls it out. So did the Social Security pay a deceased person? Yes. And then politicians use that and say, oh my gosh, Social Security is so incompetent, they're paying deceased people. But they don't tell you that they get it back too. So, but again, that's an attempt to destroy Social Security. And let's see, Teresita, I only receive $1,226 monthly on SSI and SSA. Yeah, I don't think you receive that much on SSI because the max you can get is $967 on SSA. $182 in food stamps and no other income at all. I hope they won't cut my medical. Yeah, if you are receiving SSI, I don't know if you might be receiving, there's some states that pay a state supplement. So maybe you're living in California. So the federal government from SSI pays out the $967. And there's some states that say, hey, in our state, $967 ain't going to get it. So they give you a state supplement. So that might be the case. The state is also paying for your Medicare Part B premium, the $185, which is awesome. A lot of people miss that, and they don't realize that they can have the state pay for their the $185 for them. But the big beautiful bill, yeah, a lot of people are going to have a problem with that. A lot of people are going to lose that Medicare savings program, and they're going to have to pay that $185 themselves. And unfortunately, it's going to be very, very tough for a lot of people. And then there's so much other stuff that happens because of it. So so the states, because they're going to be losing all this money, some states, I'm fearing they're going to take a preemptive strike and say, hey, since we're going to lose money next year from the federal government, we need to start tightening our belts now. And we're going to make it more difficult for people to get Medicaid. And if they don't sign the form in the right place, or they, are day late in getting their forms in, we're just going to go and deny them. So unfortunately, I think that's that paperwork purge that some states out there are going to try. And that's why I'm putting together this new platform, this new website. It's not a website, it's a community to where we're going to be able to look out for each other and help each other make sure y'all get the forms in at the correct time and everything is filled out correctly so you don't lose your benefits. But it's still, even if you do everything perfectly and you do it exactly on time, you send it to your local, Medicaid office or wherever you send it to, it doesn't matter. If there's nobody there to process it and they don't process it for a month or two, you still might lose your benefits. So there's a lot of people out there that think none of this big, beautiful bill thing affects them because, they're here legally, they're American citizens and they're elderly and they're working and yada, yada, yada. And here is going to be the mantra for the next 12 or 24 months. Wait, I didn't think that had anything to do with anything with me. I didn't think this would hurt my family. Why didn't anyone warn us? I thought Medicare was safe. I just assumed it wouldn't touch us. And yeah, so we're going to hear that a lot over the next 24 months. So even if you're entitled, even if you're eligible for whatever benefits you're getting, you could still be kicked off temporarily. And that's going to be a nightmare for you, for people out there, because you didn't fill out the paperwork 100% perfectly, and they rolled back those provisions that are supposed to help you, and they just wanted to make it harder. And if you disagree with me, look at the big beautiful bill, and you can see they rescinded. They didn't rescind, they delayed for about 10 years. So there was a bunch of laws that were supposed to start that says, hey, civil servants are supposed to go out of their way, which they always should have, but don't have staff. They should go out of the way to help you make sure if you get the wrong form in, they're supposed to reach out to you and help you. If you check the wrong, check box, they're supposed to go out there and say, hey, you checked the wrong. But that law, they decided, no, we're not going to do that. We're going to delay it for, years and years and years. So it's completely up to you to get everything filled out 100% perfectly. And even if you do, if there's nobody in the local office because there's no staff in the Medicaid office or the food stamp office or the Social Security office or whatever, then So this is what you need to do, is reach out to your politicians. The federal politicians, obviously, they've thrown their dice, but now it's going to the states. So reach out to your states and say, hey, all of this craziness is going to start coming down to the states. It's going to trickle down to the states. What are you doing to make sure that, my benefits don't stop? My benefits don't get delayed. So let's see. Question. My friend has special needs, cognitive, and has been on SSI disability. She has to fill out a CDR and is terrified of losing her Medicaid. Anything I can tell her that will help her? She has to fill out a CDR. Okay, so she did get a CDR, continuing disability review. So for some reason, I'm not able to show the questions on the screen today. So anyway, technical problems. I told you I'm from the 1800s, so this tech stuff. Anyway, so as I always tell people, the CDRs, don't sweat them until you actually get them. Okay, but it looks like this person actually got them. So on my website, it has a section there on continuing disability reviews, and I've got tons of frequently asked questions. How do I fill it out? And who receives the long form? And does the SSA, all these type of questions. So, knowledge might help her out in terms of, feeling a little bit better about this. But even if you do the CDR, even if you get a CDR, a continuing disability review, they're just doing a medical CDR to determine whether you're still medically, eligible to get Social Security disability benefits. So because she has cognitive issues, special needs, remember, if that's the case, she might have a representative payee. So a representative payee, so you or a family friend or whatever, if there's no one there, some type of local organizations also do that as well. It's called a representative payee. It's basically Social Security appoints someone to be responsible for that person's benefits. So a power of attorney, Social Security does not recognize a power of attorney. Why? Because a power of attorney, you have to be of sound-minded body and able to do stuff to give your rights like that, your power of attorney, over to someone. And if you're able to do that, that means you're able to take care of your own stuff. So that's how Social Security thinks of that. But for whatever reason, you're elderly or disabled, or you're just not able to take care of your own benefits, then you assigned, and someone is assigned to be the representative payee of that person. So the representative payee, you or a family member, can fill out those continuing disability forms for her. And also remember, this is also a budget issue. So every year, Congress allocates a certain budget to go for continuing disability reviews. So your local office, got an allocation. They had to do 100 CDRs a month. So what they do is they send out 200 forms because they're not going to get most of those forms back. People move, they don't send it back, whatever the case may be. So, but they still have a quota of 100. How do I know I've done this? Yeah, I've had to keep on the quota myself in my office, so it's a nightmare. We always had to help other offices because we were so awesome. But anyway, my staff was so awesome. But even if you fill it out, make copies and return it, and then forget about it. Because your office, she might be one of the second 100. So you fill it out and you get it in, and there's a stack of, 112 CDR packets that came in, and they only need 100. They've only got enough money to process 100. So she's one of the other 12, so they just basically shred it and says, okay, well, all right, guess we'll see you next year, 2 years from now, or 3 years from now. So even if you have it, fill it out as best as you possibly can. If it takes a representative payee, you have to be appointed the representative payee, so you have to contact Social Security and be appointed the representative payee, and then you can fill it out, make a copy of it, return it, and then forget about it. Forget about it. So please forget about it, because that's going to just make your life so much more aggravating if you're sitting around there every night twiddling your thumbs, wondering when you're going to, get a response. So they might not even do anything. So I was working, but I'm waiting to get paid from the Department of Labor and Industry to see if they can pay me. So Department of Labor, yeah, so it sounds like a disability type thing. So that really doesn't affect Social Security at all. What's the minimum you can make before you get your spouse benefits? The minimum you can make, well, for spouse benefits, your benefits on your own record have to be less than half of your spouse or your divorced spouse. So less than half. But you have to look at the right numbers. You have to look at what's called the PIA. A lot of people miss benefits because they look at the wrong number. They say, hey, Bob, how much is your check? Oh, it's $1,000. Oh, okay, my check is $500. So I guess I can't get benefits on your record because mine's not less than half. But you're looking at the MBA, which is the monthly benefit amount. You don't look at that number. You look at the PIA, because Bob might have retired early. His PIA might be $1,400, and then you would be eligible for benefits on his record. So you have to find the PIA, the primary insurance amount. How do you do that? You can go into SSA.gov, set up an account, and it'll tell you what your PIA is. Or you can call Social Security and say, hey, I want to see if I can get some money off this guy here. And they'll check, and if you're eligible for benefits, they will set up an appointment and get you your money. And it's a beautiful thing. How does the BBB, the Big Beautiful Bill, really benefit Social Security recipients younger than 65? Doesn't. If you're making, relatively good money, you're going to get that $6,000 tax deduction. But 50-60% of people that are receiving Social Security, if that's pretty much your only income, your major source of income, then you probably didn't pay taxes on Social Security anyway. So it doesn't help most people. It helps people that are making more money. But because that revenue stream of people paying taxes on their Social Security is no longer coming into Social Security, then unfortunately the Social Security Trust Fund is going to run out sooner. And because it's going to run out sooner, we're going to get cuts sooner, and they're going to be deeper. So unfortunately, the Big Beautiful Bill in the short term, it might help some people. If you're making pretty good money, it'll help you. If you're not, then it ain't helping you. But it's going to hurt everybody in a few years when everybody has to take that cut. So what is the normal process time for back pay owed to you? I've been waiting 4 months. It really depends on what type of back pay. If your case was a Social Security disability insurance case and went to the administrative law judge or something, then yeah, it usually takes a while because the judge has to write up the order, or they give it to a writer to write it up, and the judge has to sign it off, and then they send it to the they send it to the regional processing center. Well, they don't. Doge closed down a lot of the regional processing centers, so I guess that's. But anyway, 4 months if it's a administrative law judge thing. You should be getting some here pretty soon. If it's anything else, 4 months is way, 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 way too long. So I would reach out to that office, or I would reach out to your politician and say, hey, what's going on here? And speaking of that, I've got some video questions that I want to go ahead and get to. Let me see here. Let me find my videos. So I've got on my website, if you go to my website on the bottom left, it has a little place where you can record a video. And we've got Heather back, and we've got some good news from Heather. Let's check out what she has to say.
Hi, Ed. It's Heather again. I just wanted to thank you again about your advice about contacting my local representatives, I guess. And because as soon as I did that, it was amazing how the people I've been trying to contact for a year were suddenly very concerned with my situation. So yes, thank you. And I did get it.
Okay, so start off, what she's talking about is she made a video before, and I answered her video live on here. And it's basically, if you're having issues like this other person having issues with the waiting 4 months, she was waiting a lot longer than that. What you can do is file what's called a congressional. And you just go into your federal representative, your congressperson, senator, and you can call them up, call their office, their Washington office or the local office, or you can just go on their website. On their website, it always has a little button that says, I need help with a federal agency. You click on that button and you put down there, I need help with Social Security. I've been waiting 4 months or 8 months or 10 months and I'm not getting any response. And that becomes a congressional. That congressional goes to Baltimore, the headquarters of Social Security, and then it trickles down to the local office. And those congressionals, they're supposed to respond, supposed to call you almost immediately, 24, 48 hours. They call you up and they say, hey, okay, we've got it. We're looking at it, or we've got it. We just fixed it. And that's what happened to her. So when you call your politicians, contact your politicians, if you have that type of issue, you've been waiting for way, way too long, tell them about that. And if you don't mind, say, okay, why do we have to? I mean, we paid for service. We paid for this help. Why are you not giving the Social Security Administration, resources, human resources, computer resources to do this? Why in this time are you cutting thousands of jobs, cutting thousands of people from Social Security that are supposed to be there to help us? So service is going to get far, far more worse. So ask him that.
An appointment. So that's good. The person that I did speak with about setting up my interview told me that I was at the max. So that was disappointing, considering that online, whenever I did the online calculator, it says that my family max is 1,296. So not knowing how accurate that is, I suppose, that would not be the qualifier, in fact. So my question after that would be, if I thought that my disability began before 22, how difficult and would it be for me to prove that, considering that I believe that my disability began before 22?
Okay, so another two things. So she's talking about the family max. So there's a maximum that can be paid out on a particular record. And Social Security, it's like 150 to 185%. And Social Security, the internal, they could tell you what the family max and they can print it off on it. Anything other than that is just an estimate. So they'll tell you what the family max is. So let's say if your family max is $2,000 and you are receiving $1,000, then the leftover is $1,000 that could be paid to children. So if you have, two children, each child will get $500 for a total of $1,000. If you got 3 children, it'll be $333 each. If you got 4 children, they get $250 each. So it's divided up like that. So, and then the other question is, so she filed for disability benefits. Finally, it's moving forward, it looks like. But she's arguing that she was disabled before the age of 22, and that's important. Because if you become disabled before the age of 22, you can file for what's called disabled adult child benefits on a parent's record. So if a parent is receiving retirement benefits, disability benefits, or has deceased, then you can file for benefits on their record. If you're under 18 or you became disabled before the age of 22. So Heather, if you are saying that you became disabled before the age of 22, then I would definitely fight that. So it sounds like I think you filed for benefits on your own record, so you just need to go back and file a DAC claim, a separate thing. But I got to warn you on anything like this. Cautionary tale. If you go in there and with anything, so if you're filing for disability benefits on your own record and they say, okay, we determined you became disabled 6 months ago, and then you say, no, it was 12 months ago, you go in there and file a reconsideration appeal, that means they're going to reopen your case. And the next person might say, why'd this first person even, approve this case in the first place? So that's I haven't seen it happen very often, but I just have to throw that out there as well. But other than that, if you think you became disabled before the age of 22, go for it. Go for it. Absolutely go for it.
Hi, I'm Patty. I get SSDI, have since 2010. I am by myself. Husband died. Actually, ex-husband, we divorced. And he died 3 years ago. With everything that's happening with the money issues and all, what is it can I do to make sure I keep what little bit of money I get? Medicaid is not helping as much anymore. I get 119. That's it. And what do I do to try to keep that money, if not more? Thanks.
All right. With everything else, yeah, you just have to make sure you're getting the right benefits and, watching the channel and talk about, you're eligible for any survivor benefits, spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits. But yeah, you said Medicaid isn't helping anymore. So it sounds like what happened, a lot of people don't know this, is, Medicaid, is not just Medicaid. Medicaid, there's several different levels of Medicaid. You've got QMB, you've got QI, you've got SLIMB as they call it. You've got different levels of Medicaid. So, and she says Medicaid is not helping anymore. That means probably at one time she had the higher levels of Medicaid, but then she was downgraded. So she has to pay more co-insurance and, more co-payments, and she might have lost the $185 that they were paying for her Part B premium and maybe her prescription drug, the extra help with prescription drugs. So yeah, it's a cascade effect. And if you're receiving a Medicare Advantage dual eligible plan and you have the higher levels of Medicaid, you got the grocery card, which they do exist. It depends on where you live in the country and, but they do exist. $100, $200, $300. So I'm afraid that's your situation is what's going to happen to a lot of people that are saying, hey, I'm eligible for Medicaid, so it's not going to bother me because I'm a U.S. citizen. Well, okay, yeah, you're going to get Medicaid, but they might just, because of the state budget, you can't cut $1 trillion out of a budget and then expect, there's not a, number one, people that are undocumented don't receive Medicaid. So that's it. And there's not $1 trillion of 26-year-olds in the basement of their parents' house playing Nintendo. There's not $1 trillion there. So that $1 trillion goes out of everything, and it's going to have ripple effects, unfortunately. And there's going to be states, again, that take preemptive strikes. So people are saying, I don't have to worry about it now. It doesn't start till next year or 2 years from now. Maybe in your particular state, they might, start it sooner. We don't know. but I'm going to keep an eye on this, and we will help when that time comes.
Hi, I'm going to be 60 this year. I am on disability. I was married for over 16 years and I didn't work much because I was having children. I would work a little bit. So my disability check is right about $500 a month and I am unable to work due to my injury. My ex-husband, who I was with for over 16 years, is retired. Can I get can I get half of what his amount is because I am disabled and he's retired?
Okay, this is a good question. I like to answer this one like almost every time because we got a bunch of new viewers that pop in. And if you're receiving disability benefits, people miss this. They think, okay, because I'm receiving disability benefits, I can't get anything else. Or I'm receiving disability benefits, but if I switch to surviving spouse benefits or divorce spouse benefits or independently entitled divorce spouse benefits or whatever it is, then I will lose my disability, which is fine because I'll make more money, I'll get more money. But if I lose my disability, I'll also lose my Medicare because I'm not 65 yet. That is 100% incorrect. That is not true. That is a misunderstanding. Please share, like, subscribe, so we can get the word out there. Tell your friends, people on disability, and says, hey, you can get benefits off that one person you were married to back in the 20s, in your 20s, because you can still get those benefits. Okay, so for your particular case, number one, you have to be at least 62 years old. So that's the issue. The only time you can get spouse benefits is what's called disabled widows benefits between the age of 50 and 59. If you have to be disabled and had to be married to the person, to someone that passed away. So a disabled widows benefits. Okay. All right. But other than that, you have to be, for just regular survivor benefits, you have to be 60. So if you were married to someone that passed and you're eligible, based on how long you were married, you can get those benefits at 60. If not, at 62. And it will not stop your disability. So let's say you're 62 years old and you said you get $500. Let's say you're eligible for $1,000 from your spouse, your divorced spouse. Then you'll get $1,000 minus your own. So you'll get $500 on disability plus the difference, $500 from the spouse. So for a total of $1,000. So you'll basically be getting three benefits. You get your disability. On top of it, you get your spouse benefits, and you're still going to get your Medicare, even though you're not 65, because you're on disability. So getting those spouse benefits does not stop your disability. So many people out there that miss that and are walking around they're having a hard time, and they've got hundreds of dollars out there, $1,000 out there waiting for them, and they're scared to start it because so let's help those people.
So tell her to file.
Yes, I would like to know, I'll be turning 62 and I'm on SSI, and I would like to know when I'm divorced and I was married 10 years, over 10 years, and can I go and pick up SSDI on his record or just regular retirement Social Security? He is retired and he's 62. Regular retirement. Thank you.
All right, thank you. Let me move that back there. Okay, so yes, if you're 62 years old, same type of situation, you have to file for benefits on your own record, unless we're talking about a surviving spouse claim. So that's the only time. So if you want to file for spouse benefits, divorced spouse benefits, independently entitled divorce spouse benefits, you have to file for benefits on your own record first. Okay. And then if the other benefit is less than half, then you can add that on top. Okay. For surviving spouse benefits, you don't. You can start survivor benefits as early as 60. You don't have to start your benefits on your own record. You can file for surviving spouse benefits and then let your other benefit continue. So, and you said you're on SSI. So if you're on SSI, the welfare-based program, then you actually have to file. So you're mandated. So SSI is a welfare-based program. Maybe you just mean, you think SSI means Social Security income, but it's different. But if you're on SSI, actual SSI, you have to file because SSI comes out of the general taxation. It's a needs-based, welfare-based program. It doesn't come out of the trust fund. It comes out of general taxes. So in order to take care of general taxes, they say, hey, if you're eligible for benefits anywhere else, you have to take them. So, but if you're just on regular Social Security benefits, yeah, if your spouse is, your ex-spouse is 62 years old, you can file for benefits on their record. Absolutely. If your benefit amount, full benefit amount is less than half. So you just call Social Security and say, hey, I was married for at least 10 years, or I was married to someone when they passed away. Can I get any money on that person's record? And they'll tell you whether you can get some. And here's another thing that people mess up on. So if you call them right now and that you say, okay, can I get any benefits? I was married to the person for 10 years. I'm not currently married. I'm 62. I've already filed for benefits on my own record. My previous spouse is currently receiving benefits. And can I get any more money? And then they will look at the calculations. They'll look at, whether you're receiving less than half. And then if you're not receiving less than half, your benefit is not less than half, they will say, no, you're not entitled, not eligible for benefits. And I always told my employees this, you need to finish that sentence. You need to finish that thought because people hear that, no, you can't get benefits from that person. And then they go on for the rest of their life thinking they can't get benefits from that person. So come on, people, reach out to your people, your relatives, the little lady down the street, and check with them. And say, hey, weren't you eligible for benefits weren't you married to some guy for 10 years? Yeah. But I checked, I called a few years ago. They said I'm not eligible. Okay. At that time, you might not have been eligible. But maybe that person has worked a lot more in the last few years and their benefit amount has gone up. And now you are eligible. Or what usually happens, if that person passes away. And if that person passes away, it's not the 50% rule anymore. You can get up to 100%. And so if you have an X and you check to see if there's any benefits and the calculations don't work, then kind of keep an eye on, their whereabouts and if they ever pass away. Or when you call up the first time, say, oh, okay, all right, so I guess the calculations don't work. Let's say if something should happen to that person. I'm not saying I want anything to happen unless you do it. But anyway, but if something happens to that person in the future, am I eligible? And they'll say, oh yeah, if something happens to that person in the future, oh yeah, you'll get an extra $500 or $1,000 a month. And you're like, oh, okay, all right. And then if you don't keep in touch with that person and you don't know, if that event happens or when it happens, then you just need to call Social Security like every 6 months. And say, hey, I want to file for survivor benefits on that person. You don't need to know the Social Security number. If you don't have it, no big deal. Just tell them the person's name, their date of birth, their age, as close as you know it, where they were born, city, state, and the Social Security employee will be able to find the record. And every 6 months you call up and say, hey, I want to file for survivor benefits on that person's record. And they'll say, yeah, sorry, you can't. Why not? Well, survivor means that person passed. Their person is still around. So you say, okay, all right. Talk to you another 6 months. So that's the strategy that you should use going forward. And please share that with everybody else out there so your friends and family get what they need. Let's get another question here.
Hi, I'm 62 years old. I just retired 2 months ago, and I just got on SNAP benefits last week. I just got my card last week. So this BBB bill is saying that in order to continue to receive SNAP benefits, I have to work, 40 hours or 80 hours a month, something like that. But I'm already retired. I can't go back to work. I barely made it to 62. And even if I did go back to work and applied for SNAP, they would say you make too much money now because you're receiving Social Security and working. So I don't understand how they can expect people to go back to work, especially people who've retired. So my question is this work requirement for SNAP benefits, does that still apply to people who are already retired and receiving Social Security?
All right, thank you. Yeah, that's a big question going forward for a lot of people. So the Medicaid thing, it's from if you're from 18 to 64, then yeah, you have to do it. The SNAP thing, they didn't really put down a time frame for when they're going to institute that yet, and they're given a lot of latitude with any type of federalist type thing like that, or like with Medicaid, where it's a federal program, but the federal program sets, particular, floors, particular, laws and regulations. And then it says, okay, here's the national standards. You have to be at least this national standard. And then the states go, okay, all right, so we will go up to the line on the national standard, but then we might do some extra stuff. And states have a lot of flexibility to do with what they want. So even if it said X, Y, and Z in the particular, the big, beautiful bill, your state might be doing something different. And again, states are going to see the writing on the wall and realize that they're going to get a lot less funding next year for all of this. Food stamps are really going to be cut. Because, the billionaires need another yacht. So we have to chip in for that. So that, yeah, the work requirements for the SNAP isn't in there yet, but I see exactly what you mean. It's like, okay, I'm barely getting it. If I go out there and work, then in order to get the SNAP benefits, I don't get the SNAP benefits. And if you're a lot of disabled people or something like that, or they're disabled, but they weren't approved for disability from Social Security, because they were, Social Security made the wrong decision, or they're borderline, or whatever the case may be, they're going to go out there and hurt themselves working, and it's going to, cause everybody more money along the way. Again, a lot of states have done these work requirements. People 26 years old, playing PlayStation. Okay, I can see that, unless there's some type of, disability or something like that. But yeah, we're not going to. I'm going to keep up on it, and on particular states. If you are in a particular state, I know Georgia. If anybody out there from Georgia, please, if you're dealing with that, get in the comments and say, "Hey, I'm in Georgia. They have these work requirements. These are the hoops we have to jump through. These are the nightmares we have to deal with. Here's why the program is good or not." People in Arkansas, same type of situation. I think in Idaho and Arizona is calling for an exception or something. So each state is doing something a little bit different. The whole thing is crazy.
Hi, I'll be 62 this year, and a Social Security advisor suggested I collect my widow's survivor Social Security off my husband. I don't know if that's what it's called. And my teaching, just do retirement through my state for teaching, my teaching career, and to make sure the month I apply to not make more than whatever the monthly limit is. My question would be, what about medical? Because I'm only 62.
Yeah, a little gallows humor there. I know what you mean. Okay, so, yeah, I'm surprised I'm saying this, but there's a company out there that gives these cute little certificates. I'm not going to say the company; it's educational company, scare quotes. They got this little thing where they give you a 2-day class, and then they certify you as a Social Security expert after 2 days of an online class. It's crazy. So when you're hired by Social Security, it's a 3 months it's a 3 months training every single day, 40 hours a week for 3 months. And then all of your cases are reviewed for months and months and months and months after that. And there's ongoing training and stuff. So yeah, these people that go out there and give this cute little certificate and they put it on their business card that they're Social Security advisors, please stop. Please stop. You're giving out way too much information and misinformation. But on this particular case, you actually did a good job. So in this particular case, so you knew your lane. Yeah, you can collect survivor benefits, as I think I talked about before. Yeah, the survivor benefits, you can collect on that one, not touch your own, continue to wait for your own to increase. And then in the future, up until 70, any time between 62 and 70, then you go ahead and jump on your own record and get that extra money. Absolutely. But in terms of Medicare, yeah, it sounds like you confused the Medicare and Medicaid, which, RFK was doing that in his testimonies too. But anyway, that's kind of embarrassing. But yeah, Medicare starts at 65 years old. And if you ask me, once you start your retirement benefits, whether it's survivor benefits or disability benefits, then if I was in charge, I would make Medicare start immediately as well. But I'm not in charge. So you have to wait till you're 65 years old, unfortunately. And what do you do between now and then? If you're low income, low resources, yeah, you definitely apply for Medicaid or whatever they call it in your particular state. And they will give you, Medicaid if you're eligible, low income, low resources. But if not, you'll have to wait till 65. And if you can't get Medicaid, then the only other option is the Affordable Care Act, Marketplace Insurance, Obamacare, whatever you want to call it. And you go ahead and get that, and that one's going to be hurting as well because they're getting rid of a lot of the subsidies and cost sharing. So some people's, Affordable Care Act plan is going to go up by about 75%. And so they're just going to drop plans, and it's going to raise the prices for everybody. So unfortunately, that's going to hurt too. There's so many crazy ripple effects that are happening across all of it. Yeah, it's not going to be good. All right, let's see what else we got here under the types of questions. I'm on survivor benefits now, but turn 66 in 10 months in October. What should I do and when? So survivor benefit, and you turn 66 in 10 months in October. Well, you can go ahead and file for switch over to your own record. That's a little, if you need the money, if you need the extra money, go for it. You can start, if you're on survivor benefits, you can switch over onto your own record at any time if it's more. But remember, you stay on survivor benefits, you don't touch your record, and your benefits on your own record continues to increase until you hit 70 years old. So you might want to go ahead and start it at 66 in 10 months, or you might want to wait another year or so until it turns 70. That's 100% your decision. And so I would call Social Security, when you're getting ready to kind of apply there or now, and saying, don't talk to someone at the front window. The best way to do it is actually set up an appointment and take a claim, because that's when you'll get the official numbers. And then you say, okay, if I start my benefits now, I'll get another $500 more than I'm getting survivor benefits. And then you say, okay, well, what if I wait till 70? How much more will I get then? And it'll say, okay, you'll get $750 more, for example. And you're like, that's extra $250. Do I want to wait, another year or so for an extra $250? How's my health, longevity in my family? Do I need the money? Then you need to start asking you all of those. So, all right. Looks like some people couldn't hear the question on this other thing, but all right, I'll fix that. Hospitals closing everywhere. Yeah, that's going to be, there's one that was closed in Nebraska, and even the ones that aren't closing, because they're going to have, $1 trillion less, and people are going to stop, out of the Medicaid system. A lot of, hospitals depend on that Medicaid money coming in. And when that is reduced considerably, hospitals that were already hurting are going to be hurting more, and they're just going to, shut down. Or possibly what's worse is you've got these private equity firms that go out there, and some of these, they just go in there and they're looking for a quick buck. And if it's a private equity firm, a bunch of people that are, doctors, and they put a bunch of money together and they go and rescue hospitals and they make it better and update these CAT scans and the MRIs and provide better services, then more power to them. But unfortunately, a lot of these are just investment groups that go into hospitals. They buy it cheap because, the people that own the hospital are desperate. They sell it cheap. And then the private equity firm just cuts staffing and doesn't upgrade anything or sells the land, and then looks for a quick profit. And what they do is they usually set up like two companies. So they buy the hospital with one company, and then they set up another company, a management company. And the management company charges the hospital for management. So that's where they take out all the money there, is they charge outrageous, management fees when their management is just, hey, we're going to kill this hospital. And then they load up the debt on it's just, there's been a bunch of national stories about these private equities. And most of the time when they come in, it ain't good. It ain't good. So I'm on survivor benefits. Okay, I already answered that one. What's the best route when you're disabled and on Medicare Advantage plan at the age of 61? Okay, so I always say check out Medicare Supplements plan, the Plan N and the Plan G. That way you don't have, prior authorizations, you don't have networks and all the rest of it. But in most states, if all you have is the only thing available to you because you're disabled is a Medicare Advantage plan, then that's the only thing you can get, which is okay. It's better than just having original Part A and Part B alone. But you just have to stay up on it. And next year, I think there's going to be a lot of changes with Medicare Advantage plans. So you need to make sure you review your plan. And remember, when you turn 65, you are eligible to get one of those Medicare supplement plans. They can't deny you. They cannot charge you extra because you're in essentially your initial enrollment period. So at 65, it doesn't matter your pre-existing condition. Anybody can get a Medicare supplement plan. Plan N, Plan G, no prior authorizations, no networks. You can go anywhere you want. That takes Medicare. And those are the ones I always say check out first. But it comes at a monthly premium. So if it's not in your budget, then hey, it's not in your budget. And then you get a Medicare Advantage, but you just have to keep up on the Medicare Advantage, and you might have to fight prior authorizations. Always fight. If they deny you on anything, anybody ever denies you on anything, always fight. Always, file an appeal. On my website, if you go on my website on the more, it'll show you the appeals, and it tells you how to file an appeal with a Medicare Advantage company. So, and then you can reach out to Chapter, or the sponsor of this live Q&A. You can reach out to them, and you can reach out to them anytime and see if you can switch Medicare supplement plans. You can do that 365 days of the year. You might have to go through health underwriting, which is you don't have to do it physically, you just answer some questions. And if you answer no to most of those questions, you can switch Medicare supplements and maybe save some money. But Medicare Advantage, you can only change, there's special things if you move, if you gain Medicaid, you lose Medicaid, and there's some other instances where you might be able to switch your Medicare Advantage plan now if you don't like it. But normally you'll be able to switch starting October 15th to December 7th. For 2026. And you can reach out to Chapter and say, hey, put me on the list for, October, November, and when the new plans come out, and let's see if there's anything better for next year for you. So I live in Minnesota. They don't have supplemental plan. Or New Mexico. I'm sorry, I read that backwards. Yeah, New Mexico. They do have a supplemental plan, but it might not be, because of you probably don't have it because of your disability. In your particular state, they don't offer supplement plans for people under 65. And it's basically, these are insurance companies. Come on, if you're an insurance company, do you want to give a health care plan to somebody on disability? No, you're going to try to avoid that at all costs, right? So they're able to do that because Medicare supplement plans are regulated by the state. you know, a lot of the regulations by the state. So they have gone to your state legislature and said, hey, we don't force us to give supplement plans to people under 65. Once they're 65, you know, we have to follow federal law, but under 65, please, come on, hook us up. And, you know, here's some, you know, anyway, but so some states you can, like in New York, you can get a Medicare supplement plan anytime. And that's also one of the reasons they're so expensive in New York. So, all right, we are over an hour, and also did some time before. Sorry for the technical issues there, getting it all worked out. But I will be back again tomorrow. I'll come up with another topic of the day, and we'll talk about that. And so y'all have an awesome night. Please, 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 please take care of each other and record some videos. Go onto my website, mygovexpert.com. Go to the bottom left. There's a little camera icon there. Press that little icon and record a video and ask your question, and I will answer it tomorrow. Guarantee it, unless I got 1,000 videos tomorrow. If I got a reasonable amount of videos, I'll answer it tomorrow. All right, y'all have an awesome